Today's episode is part 2 of my coverage of birth control methods. If you want to watch part 1 first, click here and then come back. Are you back? Okay, cool. Let's get this show on the road. Hi everyone, my name is Sarah and welcome back to Everyday Consent. Last week I listed all the different forms of birth control or contraception available in the US and their different rates of effectiveness. Today I want to talk more about what those effectiveness rates actually mean for you and your partner, as well as some other concerns that might come up when trying to decide on a method to use. For many birth control methods, I listed 2 different effectiveness rates, the perfect use rate and the typical use rate, and they're about what they sound like. The perfect use rate is the best possible effectiveness you can get if you use that method perfectly every time you have penis and vagina sex, while the typical use rate is closer to the effectiveness that the average person will actually experience. Note that the typical use rate is not the worst usage rate, so it's not the worst effectiveness you would get if you were really bad at using that method, it's just the average. The worst would be way lower. So even though it might be tempting to imagine that you and your partner are above average and would totally be hitting that perfect use rate, by the power of math, you're probably closer to that typical rate, and that's the one you should pay attention to. For example, if you're using condoms as your birth control method, the condom might be expired, or it might break while you're using it. Or if you're using the pill as your method, you might forget your pills at home when you go on vacation, or just have trouble picking them up at the pharmacy and miss a day or two. All of these are ways in which just being a normal person living your life might mean that you're not getting that perfect use effectiveness out of your birth control. Also, this difference is even more striking over longer periods of time. I'll leave a link to more info in the description, but as an example, if we're looking at the pill, the difference between 99% and 91% might seem pretty small. But over 10 years, that can turn into the difference between 97% and 39%. Whoa! Compare that to one of the extremely effective methods we talked about last week. Many methods in this category, such as the implant, hormonal IUD, or permanent methods such as sterilization, have typical use rates that are actually the exact same as their perfect use rate. This is because, by definition, it's almost impossible to use these methods imperfectly. That, combined with the fact that those rates are so high in the first place, means that over that same 10-year span, the implant, for example, goes from over 99% effective to still 99% effective. That's pretty different from 39%. So with all this, it quickly becomes clear that if the main thing that you care about when choosing a birth control method is how well it works, then you definitely want to be looking at that extremely effective category. So that includes abstinence, of course, as well as the implant, IUDs, and sterilization. At this point, you might be thinking, well, why even consider other methods? If there's that big of a difference, why would you prioritize anything besides how well your method actually works? The answer to that is, it depends. There are actually lots of different factors to consider when choosing a birth control method. Here's a list of many of them, but today I'll focus on these few. Currently, all of the extremely effective options besides abstinence require going to a doctor or other healthcare provider. That's not an option for everyone. Plenty of people can't afford or don't have access to a healthcare provider that they trust. Or in some cases, you might know of a provider you can go to, but not be able to get there because you don't have time or transportation, or don't want your parents or someone else to find out. This would also be an issue for many other methods that require a prescription or doctor's visit, such as the pill, patch, ring, shot, diaphragm, or cervical cap. Even if getting to a provider isn't an issue, many people might have fear or other objections to undergoing medical procedures. While only sterilization requires surgery, both the implant and IUDs do require medical procedures for insertion. This might be a non-starter for some people, especially since some of those procedures can be painful or feel invasive. The shot might also be a poor choice for someone in this case, and even the diaphragm and cervical cap need to be fitted by a provider. Speaking of healthcare and accessibility, another big issue for many people is cost. Thankfully, this is now way less of a problem in the US than it was a few years ago thanks to Obamacare, but it is still pretty complicated. Most insurance plans are now required to cover at least some birth control methods for free, and there are even some ways to get free birth control if you don't have insurance. I'll leave more info in the description. But depending on your situation, you might choose a birth control method purely based on whether your insurance covers it. It's also worth keeping in mind that withdrawal and abstinence as methods are always free, as is fertility awareness for the most part. Also, spermicides are quite cheap, and free condoms are easy to access in many places. Speaking of condoms, they're one of very few birth control methods that also protect against STIs. The only others are internal condoms and abstinence. So, if you want your method to be a one-stop shop of STI and pregnancy prevention, then condoms, internal condoms, and abstinence are your go-tos. It's worth noting that since spermicides often cause irritation, it's possible that using spermicides as your birth control method might actually increase your chances of contracting an STI. One of the biggest categories of things that people consider when choosing a birth control method is side effects. Many birth control methods have a variety of side effects, and not just negative ones, positive ones too. In fact, plenty of people who don't even care about preventing pregnancy are on birth control purely for the side effects. Seriously. Many hormonal methods, such as the pill, patch, or ring, can protect against serious health issues such as endometrial cancer, ovarian cysts, anemia, and pelvic inflammatory disease. These methods can also significantly reduce acne in many people, though the reverse can also be true. A lot of birth control side effects are menstrual changes, such as changes in bleeding or symptoms like cramping or PMS. Methods such as the pill, patch, or ring may make periods shorter, lighter, or more regular, and may reduce PMS symptoms or cramping, but depending on the person may have the opposite effects. Methods like the shot, the implant, and hormonal IUDs often make periods shorter and lighter, and can even make periods disappear altogether, whereas the copper IUD often makes periods heavier and cramping and PMS symptoms worse. So like I said, there are many possible considerations when choosing birth control methods, but these are a few of the big ones. I'll leave some resources in the description that can help you visualize these considerations in more detail, as well as a couple websites that can help you choose what method might work best for you. Also keep in mind that you can use more than one method, since many of them can be used together. I'll leave a resource about that as well. So with all that, hopefully you learned something, and this and last week's video are helpful in getting you started thinking and discussing with your partners what birth control methods might best suit your life and needs. Let me know in the comments if you'd like any more information about anything I discussed, or you can always email me at everydayconsent@gmail.com. If you like this video, please give it a thumbs up, and if you want to see more from me, don't forget to subscribe. Happy consenting, folks. I'll see you next week. And pregnancy perfection. Pregnancy perfection. Pregnancy perfection. Birth control methods. Typical use. By the power of math. You're pretty average.